How does latent TB infection lead to lymph node TB? Have you ever wondered how a latent tuberculosis infection can lead to lymph node tuberculosis? Let's break it down in a simple way. Latent tuberculosis infection, often called LTBI, happens when the bacteria Mycobacterium tuberculosis, or MTB, are present in the body but do not cause any symptoms. During this stage, the bacteria can hide in immune cells, particularly in macrophages, which are a type of white blood cell. These immune cells can be found in various tissues, including the lungs and lymph nodes. The journey from latent TB to lymph node TB, which is a type of extrapulmonary tuberculosis, begins when these dormant bacteria reactivate. This reactivation can occur in the lymph nodes, leading to an infection. It starts when MTB bacteria are inhaled into the lungs and are engulfed by alveolar macrophages and dendritic cells. These infected immune cells then travel to nearby lymph nodes, which are essential for starting immune responses. However, MTB has developed clever ways to evade the immune system. For instance, dendritic cells infected with MTB may take longer to migrate to the lymph nodes and do not effectively stimulate T cells. T cells are crucial for controlling infections. This delay allows MTB to survive and multiply within the macrophages in the lymph nodes, creating a safe space for itself. In the latent phase, MTB can cleverly avoid being killed by the immune system. When the immune system weakens due to factors like immunosuppression or other health issues, MTB can reactivate. When this happens in the lymph nodes, it leads to the formation of granulomas. Granulomas are clusters of immune cells that try to contain the bacteria but can also disrupt the normal structure of the lymph nodes, causing inflammation and damage. Lymph nodes are often affected by extrapulmonary tuberculosis because they play a key role in immune cell movement and presenting antigens to the immune system. When MTB reactivates in these nodes, it can spread back to the lungs or other parts of the body, making the situation worse. Research shows that lymph node TB involves strong inflammatory responses driven by T helper 1 cells, but it also includes issues with tissue repair processes, which adds to the problem. In summary, latent tuberculosis infection can lead to lymph node tuberculosis through the ability of MTB to persist in macrophages within the lymph nodes during latency. The delayed immune response and eventual reactivation cause granuloma formation and damage to lymph node tissue. This process highlights the lymph nodes as both a reservoir for the bacteria and a critical area in the fight against tuberculosis. If you have concerns about tuberculosis or your health, it is always best to consult a healthcare professional for personalized advice.